Well, welcome to our webinar. So, we're going to give a couple of minutes for anyone that isn't on the call to join in. Remember, share this link with everyone that you know. Share it with your friends, share it with your family, people that you know want to know more information about reversing diabetes. This is the best place to be. Having to our dietitian Tito of the Meditrina and reversing to miss out everyone a call. You're sending on YouTube, you're sending to them on free because it was going to give a couple more minutes to before send me this link. All right, so a couple more minutes. The link is in the comment section, it's in the chat section. Make sure that you're viewing it, make sure that you're sharing it, make sure that you're doing what you need to. We want everyone here so that you can ask questions, you can bring up the concerns that you have when it comes to reversing diabetes. Many people have questions like, is it true? What does it mean? Can you actually reverse diabetes? But I won't be telling you any of that. Like I mentioned, Dr. Maka is on the call this evening. She's going to be giving you all the information you need to know about diabetes. And then we're having registered dietitian Tito coming up to give you everything that you need to know about reversing diabetes, how it works, which you need 100% from the experts, from the professionals themselves. So, a couple more minutes, and then we're going to kick straight into it. All right, so we're about to go straight into it. Once again, you're welcome everyone to the Meditrina's Diabetes Reversal webinar, where we give you all the information that you need from the experts to know what it means to reverse diabetes, find out if it's possible, and know how exactly you can go about reversing diabetes for yourself or for your loved ones. Like I mentioned earlier on the call, this evening we have Dr. Amaka. She's going to be telling us everything that we need to know about diabetes. So I'm going to hand off to her so that she gives us all the information that we need. Hi, Dr. Maka. Can you hear us?
Yes, I can.
Good evening. The floor is yours.
Okay. Good evening, everyone. Happy Sunday. My name is Dr. Amaka. Today we'll be talking about diabetes and how to reverse it. Now, let's start with a little definition. Diabetes is a chronic disease that is characterized by persistent increase of blood sugar or glucose in the body that will now lead to all those complications in the heart, in the brain, kidneys, and every other organ it affects. Now, let's pick out some keywords. So, what is glucose or sugar that everybody knows about? Glucose or sugar. Now, glucose is the main fuel the body utilizes to do its normal function. Glucose is the fuel of the body. Now, another keyword I want us to look at is insulin. Insulin is a hormone secreted by the pancreas to regulate blood sugar. Now, we get glucose or blood or sugar from food that we eat. Also, the liver produces glucose too from stored glycogen. Now, what about the types? We have the type 1, the chronic conditions, we have the type 1 and the type 2. Now, for type 1, it was previously called juvenile diabetes, but now, you can see it in the elderly. Here in type 1, insulin is not secreted at all. And also here now, the prevalence is very, very small, like 10% of the population have type 1 diabetes. It can be caused by environmental factors. Now let's talk about the type 2. Now, according to the prevalence too, 90% of the population have type 2 diabetes. Here, insulin is produced, but there is some form of resistance. There is insulin resistance. Here now, for the type 2 is more common. And now talking about the cause of this type 2 diabetes, let's look at the metabolic syndrome. Now, so we have like five things that make up the metabolic syndrome. One of them is hypertension. Now, for people with metabolic syndrome, they have their blood pressure is usually high. Number two, they are obese. Yes, their BMI is high. They have high triglycerides also. Now, they have pre-diabetes. We'll talk about pre-diabetes later, but their blood sugar is usually within 100 milligram per dl. Now, that is it for the metabolic syndrome. Now, we also have family history. Yes, we have a sedentary lifestyle. We also have smoking. Now, these are some of the things, there are a lot of things that can cause type 2. We also have the iatrogenic factors. Here now, for some people that are being placed on some steroids, now sometimes they can tip into having type 2 diabetes. Now, this is the iatrogenic cause. Now, let's look at the symptoms. They have the popular 3P for diabetes. We have the polyuria, producing large quantity of, urine. Polyphagia, they have that urge to eat so many things. And polydipsia, thirst. Once you are urinating a lot of urine, water is leaving your body. Now you will be taking in many fluids. Now, another thing is weight loss, unexplained weight loss for diabetes. Now, some other symptoms is blurry vision. Now, I've seen some people the first time they noticed they have diabetes. But when they came to the hospital with a complaint of blurry vision, and some tests were done, and boom, they have diabetes type 2, and we started managing it from there. Now, some some other people slow healing sores. Yes, slow. I'm sure that some of our audience, some people, you just have this little wound that normally should disappear within, should heal within 1 week or 2 weeks. But lo and behold, 2 months, you are still nursing the same wound. And now when you now go to do some tests, you now find that there is type 2 diabetes and hyperglycemia prevents wound healing. Now we have other things like recurrent vaginal itching, vaginal infection, gum bleeding, and these are some of the symptoms of diabetes. Now, what are the risk factors? I have mentioned some of them: the race, yes, family history, smoking, and other the other type that I mentioned before. Now let's look at gestational diabetes. Now gestational diabetes occurs mainly in pregnant women. Here, their blood sugar is high. There is also glucose in their urine, but usually it doesn't come with any symptom. Usually, it doesn't come with any symptom. But for some people, you, they can have symptoms. Now, also in this for gestational diabetes, now the placenta hormone kind of causes the insulin resistance. Now, in pre-diabetes, their, like I've mentioned before, their sugar is high, but not high enough to be called diabetes. So now let's now look at the complications. There are so many complications. The hyperglycemia of this diabetes causes. There are so many complications. And then let's start from the acute complication. For the acute complication, we have the diabetic ketoacidosis, usually an emergency, and the HFS state. Now, for these people, they're coming in with blood sugar that is maybe up to 300 milligrams for the diabetic ketoacidosis. Now, for the HFS state, they can come in with sugar level of over 500. Hello, can anyone hear me? Can anyone hear me? I'm not sure. Hello? Can you hear
Can you hear me?
me?
Yes, I can hear you.
Okay, okay. I think it was just hanging at some point. So now let's continue with the complications. Now the complication usually starts with this atherosclerosis, where fatty plaques deposits on the lining of the blood vessels. Now, every organ in the body, every organ, even the skin, the ears, the eyes, all of them have a blood supply. Every organ in the body has a blood supply. Now, these fatty deposits occurs in the blood vessel, the lumen of the blood vessel. Now it starts depositing on it to the extent that it becomes narrowed. Now, blood vessel that is supposed to move in, let's say it's like 100 mils, will now start moving in like 60, 50, 30. It will start reducing. And that is when the symptoms will start coming in. Now, the main supply of the heart is the coronary vessels. It will start depositing on it, it will start blocking it, and this person will come down with coronary heart diseases and the other symptoms that would follow it, like from hypertension to the rest of it. Mm. Now, another thing is the brain, the blood supply to the brain. The same mechanism, fatty deposits will block the artery. Now, this person can come down with a stroke. For the heart, the person can come down with myocardial infarction and the rest of it. Now, for the kidneys, now The kidneys have these tubes that filters urine, that filters urine like glucose normally. You don't see glucose in the urine. But now, in during these hyperglycemic states, this excess sugar in the blood now, because the kidney is working over time to filter it, you now find out that this glomeruli that filters the kidney will now start dying, and now these deaths can now lead to diabetic nephropathy, chronic kidney disease, and the rest of it. Now, the nerve cells, there is this myelin sheet that covers the nerve cell. Now, this same hyperglycemic state will start affecting it, and the sheet will start going up. And that is why people we know that have diabetes, their major complaint, they will tell you that I can't feel my hands, I can't feel my feet, paresthesia, because the nerve damage, the nerves are being damaged, and they now have sensory losses. Now, part of the one for the coronary heart disease, also peripheral peripheral disease, peripheral vascular disease, and they will start having feet claudications. And now, when they have any little wound that happens on the foot, will not be able to heal. So these are some of the complications of diabetes. Now we also talk about the complications for gestational diabetes. Now these women now that have sugar, that have hyperglycemia during pregnancy, there are complications. Now for the child might be big. We call it macrostomic baby. Any child that is above 4 kg, that's how macrosomic baby. And now, if they're coming in this size now, normally, some women won't be able to push it out. It will now lead to cesarean section. So gestational diabetes make these babies to be big. If they don't come to a good hospital, they go somewhere to push this baby, they will have obstructed labor and they might die. That's a major cause of maternal and child mortality in our country. Yes. So another complication they have with this baby, when this big baby come out, they can have respiratory problems, and that might even lead to death. And now they are coming in with hypoglycemia. Yes, because of the insulin. They are coming in with hypoglycemia. Now, sometimes you hear a woman that tell you, I gave birth to a baby and this baby died within 5 minutes. The baby just cried. And next thing, they said my baby has died. Hypoglycemia is one of the major causes of death immediately after birth. And that is the cause of gestational diabetes. That is why you and I need this, we need this information. So even if you are young, you don't have diabetes, but you are a woman or you are a man and you have a wife, you take this information home. And that is why Wella Health is here to give us information, health information that will benefit our lives. Now, the complication for the woman for this gestational diabetes I mentioned is the need for cesarean section, and also preeclampsia. Preeclampsia where the blood pressure is high and there is a protein in the urine. Yes, it causes some women to fit, and from fitting they may die. So that is why we need this information on how to control blood sugar and be healthy. The information is going to increase our health span. Even if you have maybe any of your parents that have diabetes, you can teach him or her how to manage it very, very well. You get a glucometer, you work with a dietitian. Now, this dietitian, her job now would be to help you with the food, the way to portion your food, to eat it, to know, to actually reduce the blood sugar. She will also give you, if need be, the exercise routine that is very helpful for the type of diabetes you have. Also, now, she'll give you information on the type of food you need to eat. Yes. Now, for some people, they tell you, this food is healthy, and they'll not go ahead to finish a pot of it. No, you are still overeating. Now, she's going to tell you how to portion this, how to add maybe if it's 1 tablespoon of oil, you will use it to fry your egg, and she will give you a balanced diet that will help you to maintain a healthy weight. Because in pregnancy, and if you want to move further away from getting this gestational diabetes, you need to have pregnancy at a healthy weight, and you need to maintain it too. But one thing about gestational diabetes, although immediately after delivery, the diabetes goes away, but later in life, if you are not being careful, if you are not following a healthy lifestyle, the type 2 diabetes can now come back in full, not only for this woman, but also for the child. For a child of a woman with gestational diabetes. And then if you don't control it very, very well, in your next pregnancy, you can still have gestational diabetes and all the complications that comes with it. So the information about reversing diabetes is important for everyone. It's important for me. It's important for you. You can go home and share the information with your parents. It is very good because they need to know their numbers. Yes, the World Health Organization works in a way that you can actually give them a chart of your diabetes control for the maybe 1 week, 1 month. You'll be writing it down with them, and whenever they notice that it is too high, they can be able to call your caregiver. Ah, look, Mama, on Wednesday had her blood sugar was 200. This day it was 250. So what are you feeding her? That's what the dietitian will ask. And that way, if maybe you ate Gary that Thursday, she will ask you what quantity did you eat? And you will tell her, you say, okay, I don't think this quantity is good enough for you. Let's reduce this to this and let's add more of vegetable or more of protein to make up a balanced diet. That is the beauty of working with a trained dietitian. Every one of us need it for our daily life. And another way, apart from diet, is physical exercise. Yes, you have to be up and doing. Well, a risk factor of diabetes is sedentary lifestyle, and the way to prevent it is to up your game in terms of physical exercise and weight loss. Now, for people that have diabetes and you are obese, you need to lose weight, and you have to do it with a dietitian too. So that is why all of us are here. We are working with a dietitian, we are working with a doctor, you are working with a team that is here to help you to reverse diabetes. Reversing diabetes is very possible. I have seen people that move from having a glucose level of 300 to having blood glucose level of 95, 96, 110, 120, just by working with a good dietitian, looking at what they eat, having a good exercise routine. So that is a way that you can do it and reverse it very, very well. It's not something you can do on your own. You need to do it with a doctor, because at some point now that if they notice that your blood glucose is reduced enough, now they can wean you off your medication. Like if you are taking a metformin 1000 milligram, it can be reduced to 500. Sometimes you can even have need to only take it 3 times a day. And that will reduce the financial implication that you have to go and buy the drug that you use for 1 month. And also increase your health span. Those complications in the heart, in the lungs, in the eyes, everyone, you will reduce your chances of having it. So that is the benefit of working with Wella Health. That is the benefit of working with this team. The amount they are charging is so small compared to what you will gain. So please, we can't wait to have you on board. Come and work with us. And if you don't have anyone that needs our services, a parent, an aunt, an uncle, please direct the person to us so that the person will have a feeling of what we are talking about and share the testimonies with us. So thank you. It was nice having you all here. Thank you so much.
Thank you so much, Dr. Amaka. That was very informative. That was really amazing. I'm sure that we learned a lot, and you answered the question, is it possible for someone with diabetes to be able to reverse it? So you heard it from the doctor's mouth. And now we're going to be speaking to registered dietitian Tito. Hi Tito, can you hear us?
Yes, I can. Good evening.
Good evening. How are you doing today?
Fine, thank you. Good evening, everybody. Okay, hi everyone. My name is Tito Ikumoye. I'm a dietitian. I'm sorry, I'm a little bit under the weather. But I hope that in the next 15 minutes we would be able to talk about, how you can use your diet to reverse diabetes. So first of all, Dr. Maka has said everything that there has to be said medically. And I want to say to you that yes, diet is a very important tool for you to effectively control your blood sugar, push it into remission, and live happily ever after without taking your drugs, and in many cases, reducing your drug dosage, which, the implication of that is that eventually you're going to spend less money, managing diabetes, and also, you are eating every food that you love and enjoy. So I have worked with diabetes patients for the last 5 years in my career, and one of the common things that I hear people complain about is how they are not able to enjoy meals. So you hear people say, "Oh, I can't even go to parties, I can't go to functions because my blood sugar is so high, and I am constantly concerned about everything that I have to eat." If I have to calculate, I have to think before I eat. I rather not do that. Then I have another set of people that say, well, something has to kill a man, it can as well be food, and then they just go home and die. But very early in my career, I used to wonder why people died from diabetes, because the truth is it is so easy to manage. As easy as it is to manage, people still were not getting the right kind of information and knowledge. And I used to wonder, but as I advanced in my career, I realized that it's because people did not have access to the right kind of knowledge and tools and resources that they needed to manage these conditions. And so, we talk about diabetes as in its complex form, but as simple in its simplicity. What are the basic things you need to know? There's blood sugar spike because you are eating carbs. But guess what? Carbs is the primary source of fuel for your body. That's what your body needs for energy. That's what your body needs to do its everyday functions. So you cannot completely eliminate carbohydrates from your diet. So what do you need to do? And so that's where conversations like portion control comes in, food timing, you know. I hear people say, oh, but the food for diabetes are so expensive. That's not true. I also tell people that any food that you cannot get in your local market, any food that is beyond your pocket, you have no business eating it. And so when people say, oh, healthy food is very expensive, I say that's not true. Your everyday rice, beans, eba, fufu, all of these things are meals that can be eaten even while managing diabetes. Yes, you heard me right. You can eat your pounded yam, you can eat your eba, you can eat absolutely anything, with the exceptions of added sugars and sodas, and cake, all of these other things. But your regular Nigerian foods can be eaten and enjoyed even if you are managing diabetes. Now, the problem usually is that what works for Mr. A might not work for Mr. B and definitely doesn't work for Mr. C. And so what we see, especially over the internet and from family and friends, is when someone says, I have diabetes, you just say, stop eating rice, stop eating beans, stop eating fufu. So they will just give you a list of do's and don'ts. And at the end of the day, you're wondering, so what do I eat? And then you stay away from all of these things and your blood sugar is still not resolving. That's because there are practical ways to ensure that the food options you are choosing for yourself are individualized. They are things that work for you, and that's where working with a dietitian comes in. I know a lot of people just want to hear, oh, you're not allowed to eat this, you're allowed to eat this. But guess what? You are allowed to eat absolutely anything, but you're allowed it's there is a way it is portioned to you. So for example, factors that we consider: your age, your height, your weight, your sex, your activity level. Do you exercise? Do you stay at home? What kind of job do you do? Those are factors that we put into consideration when we are planning a meal for anybody managing diabetes. Because at the end of the day, carbs cannot be eliminated from your diet. It is a primary source of energy for you. But what a man would eat and it would enable him do his everyday function is different from, the energy requirement for a woman. It's also different from the energy requirement of a pregnant woman, different from the energy requirement for somebody trying to lose weight, different from the energy requirement of somebody trying to gain weight, different from the energy requirement of somebody that is also managing hypertension, or there are so many other factors that come into it, and this is what is lost in conversations when you just talk to family and friends, and then they tell you, oh, do this, don't do that, do this, don't do that. And so what we decided to do is at Wella Health, we set up a clinic that is focused on helping people like you manage your condition effectively, and we work with diabetes for 12 weeks. And in that period of 12 weeks, we are able to work with you hand in hand, holding your hands. Like I would always say to my patients, we become best friends during that duration, because what then happens is, apart from telling you all the do's and don'ts, asking you what do you want to eat, because what is also very important to me is your food preference. So if you are your food, the meal plan of someone from northern Nigeria that lives in Kano is definitely different from the meal plan for someone that lives in Kwara State, definitely different from someone that lives in Imo State, and different from someone that lives in Uyo, because all of these people have different foods that is peculiar to them, the area they live in, their ethnicity, their culture. And so I wouldn't ask somebody that lives in the north to eat amala and ewedu, except they already eat it. And I wouldn't ask someone in Uyo to eat tuwo and black soup, except it's something that they already eat. And so one of the things we also take into consideration is your food. I would not ask you to go and buy couscous or burger if it is not something you already eat. I wouldn't ask you to eat broccoli. What you know how to eat is egusi and ewedu and okra soup that we'd have to give. And so when you come into the clinic, we have all of these conversations. What are the foods you like to eat? What are the foods you enjoy eating? And then what I would always say to people is that and our patients, around their food, force meal plan on people, because that's what the just says. Eat one spoon of, and you're wondering, am I a child? If I eat just one spoon of, I'll be hungry in the next. And for example, our clients in that work, and that is by when they are going to shift 8 p.m. or 9 p.m. Or so we preference the kind of that. What are the timing? What are the these are conversations I have by giving somebody a random meal plan. And so whether you come in physically or you come in virtually, we also, no matter the world, also talk to our parents just the way we're talking to you, but we, virtually, analyze meal plan. You can please let me know if you can hear me. Hear me?
I can. Can you hear me, Tito?
Yeah.
All right.
So, like I was saying, we would then, after we give you the meal plan, we would now call you, work with you for a period of 12 weeks. Now, what that 12 weeks entail is that we call you every morning. Now, why we do this call every morning is that, let's say your blood sugar spikes today and you're recording a value of 150, 200, 250. Some people do 600. Very crazy, right? And you record a high value that morning. It's easy for one of our dietitians to call you and ask you, so what did you eat yesterday? Because I have some patients, as much as they say, oh, oat is good for diabetes, wheat is good for diabetes, I have some patients that if they eat wheat or oats, they record a fasting blood sugar of 350, 400 the next morning. And that's why I said meal plans, your nutrition, especially when you're managing diabetes, is individualized. You know, what works for Mr. A might not work for Mr. B, and definitely will not work for Mr. C. And so for a period of 12 weeks, we are responsible for your health. So we collect your fasting blood sugar every morning, so that if there was a spike, we can easily trace it back to what you ate in the last 24 hours or the last 48 hours, and isolate whatever we think is wrong. So let's say you had fufu and okra for dinner, and then maybe rice and chicken for lunch, and bread and tea for breakfast. We're able to say, okay, what is the portion you consumed? When did you consume it? What is the food among these three things that likely spiked your blood sugar? And then we circle it out and we remove it from your diet. In 2 weeks, we reintroduce it. If it spikes your blood sugar again, then we completely remove it from your diet. Now, that is what works for you and not works for the next person. Because what I see, somebody says, oh, I did this when I first found out that I was diabetic, and then they give you the meal plan. But you find out that what is working for this person is not working for me. That's because, just like drugs, diet is individualized. I'll give you a practical example: chloroquine. When there's some people, when they use chloroquine, they will scratch and itch and it's so uncomfortable. Some people, chloroquine has no effect on them. And then there are some people, if they use chloroquine, they would have all kinds of burns and, all of those things on their skin. That's the same thing with your diet, especially when you're managing diabetes. And so one of the important things we do for you in this 12 weeks program is to ensure that whatever we are doing to you is tailored to you and your health, and to your food preferences. Now, this program goes for 60,000 naira, and the 60,000 naira covers for a duration of 12 weeks. And our goal is that at the end of the 12 weeks, you are better. You're not needing to you're not needing to join another program. You're not confused about your diet. Because another thing that happens, working with us, is because we call you every morning, it means that you are able to ask absolutely any question that you have. And so, for example, I have patients that say, oh, dietitian, so I know I have diabetes, but I also want to drink beer. I'm not going to stop you from drinking beer, please, by all means. But tomorrow morning, if we record a very high blood sugar, I would tell you that, sir, but you know that yesterday you drank beer, and that is why your blood sugar is high this morning. And that way, people are able to make informed decisions by themselves about their health. So if there's a particular thing you eat, and we are following up every morning, and every time we check your blood sugar, every time you eat that thing, your blood sugar is spiking, I wouldn't have to tell you to stop. Because now you understand, because we are going on the journey together, you can now start to make informed decisions by yourself. And that's why anybody managing diabetes should please jump on this program. We have worked with so many patients, and we have recorded, successes with all our patients. We've been able to help people reduce their drug dosage, and some people have significantly stopped their drugs. Again, we work closely with your doctor. This is not anything that we're going to do in isolation, because your doctor still has to make the call about your drug dosage. I wouldn't ask you to stop taking your drugs. I wouldn't. It's Dr. Maka's call to say, okay, based on your progress in the last 12 weeks, we think you should reduce your drug dosage or stop, taking your drugs. However, we would work with you, work with your doctor to ensure that we are able to make significant progress in your health. Now, untreated diabetes has of um, a lot of terrible things that can go wrong, and you don't want to be at that end. I have people that said, dietitian, say, let me go and die at home. That doesn't have to be your testimony. Diabetes, it can be effectively managed, it can be reversed, and you can live a healthier life. So I would like to invite you to join Meditrina Clinic. Jump on this diabetes reversal program. We are here because of you. I, for one, have a particular soft spot for diabetes management because I understand how easy it is to manage. But there's also a complexity in the techniques of managing it, and that's why you should work with me. If you sign up for our program, either physically or virtually, you get to talk to me and would have more interesting conversations like the one we are having now. And you can ask me absolutely any question. And trust me, the meal plan we would also give you is a meal plan that the entire family can use. Because what I also say to people is that people say, oh, diabetes is hereditary, but I say that it's the lifestyle that is hereditary. I have seen so many people that their parents were diabetic or hypertensive, and they none of the siblings, none of the the next generation got it because they made an intentional decision, to live healthier. And so for parents that manage diabetes, I always encourage that they also imbibe healthy living in their children. And this is where you can learn what works for your children and what doesn't. And so whatever meal plan we are giving you is not a meal plan that only one person in a family can use, because I also don't believe in that. I believe that when one person decides to go on a journey of healthy lifestyle, the entire family should work the journey with them. And that is why you and your entire household should be on this program. So one person is managing diabetes, but every other person in that family has to be on this program, so that the next person doesn't also develop this. Because what's the joy of any parent when your child is also, that your child is also most likely going to develop this condition? So it's better, even the Bible says, train up your child in the way he should go. When he's old, he will not depart from it. So this is an invitation once more to be a part of what we are doing. It's just 60,000 naira, and it covers for the duration of 12 weeks. And this 60,000 naira, what it covers is the consultation, the customized meal plan, and the daily follow-up sessions for 12 weeks. It might sound like a lot of money, but I promise you, I can assure you that the drugs you spend on diabetes is a lot more. And so we are saying, come, let's help you reverse your diabetes for just 60,000 naira for a period of 3 months. And after these 3 months, you'll be happier, you'll be healthier, and you will save a lot more money. I hope that I have been able to convince you. I hope to see you in clinic. Thank you, guys.
Thank you so much, Tito, for that. I'm sure that session was packed full. Everyone learned something. Hearing from the dietitian herself, hearing from the doctor, Dr. Maka, thank you so much, has really helped us to understand what it means to reverse diabetes, that it is possible, giving you real life example. And I'm sure Tito addressed a lot of the concerns that people have. Oh, do I have to have a separate diet from my family? And so on and so forth. So you see that these things are very achievable as a Nigerian anywhere that you are. In fact, even outside of the country. So why not take advantage of it? This program is going for 12 weeks at 60,000 naira for 12 weeks every single day. It is a very, very personalized experience. I assure you, you can't get this anywhere else. Having your dietitian speak to you every single day, knowing what your meal plan is, knowing what you've eaten, checking your blood sugar with you. So, like she said, you're making informed decisions, and you're not just having a professional telling you, "Oh, don't eat this, don't eat that," but you as well are on this journey, and you are getting the knowledge to know exactly what you need to help you keep diabetes in remission. All right. So, like she said, and I've put it in the chat section. So, if you're on Twitter or if you are joining us from YouTube, here's all you need to do. There is a WhatsApp number that I have put in the chat section. Just send us a WhatsApp message through that number, and you can join this diabetes reversal program. You can send it to your family, you can send it to your friends, anyone that you know that is currently managing diabetes. There is a way for them to be able to reverse it. The number is in the chat section. I'll also be dropping another number that you can give a phone call to, or even on this number, you can send any other questions that you have, and someone will be there to respond to you. But this is a steal. For 12 weeks, you're getting this program at 60,000 naira only. That is 3 months having a hand in hand, a very personalized experience with a dietitian, a registered dietitian who will take you through this journey and teach you everything that you need to know, help you set up a very convenient meal plan that doesn't go outside of what you are already familiar with, what you're already used to, but helping you to make informed decisions so that you can reverse your diabetes. Like we mentioned, this plan is going for only 60,000 naira for all those 12 weeks. That is 3 months. Make sure that you are taking advantage of it. Send a WhatsApp message to the number that is in the chat section right now. Don't miss out on this opportunity. get the expert help that you need. The best way to reverse diabetes is not them say. It is not worked for someone else, because what works for Mr. A may not work for you. What works for your mom may not work for you. It is a personalized experience. Everything that you do matters on this journey. Your work, your current situation, your gender, every single thing matters. And this is what our team will be putting into consideration. So, once again, check the chat section. You'll be seeing the WhatsApp number there. Make sure that you're taking that number down. Make sure you're following us on our social media. All right. You can follow us on Instagram, follow us on X or Twitter, follow us on Facebook at Meditrina Clinic, or search Chat Meditrina. You would see us there. You can send us a DM. You can find this number there on our bio in every single social media platform that we are on as well. You can ask us the question that you need to make sure that you're getting the best experience from this. Remember, 12 weeks, 60,000 naira, and you are on your way to reversing diabetes and living a happy and healthier life. All right. Thank you so much, Tito, for all the information that you passed on. Thank you so much, Dr. Amaka. It was an amazing session that we had tonight. Once again, the WhatsApp number to chat us with is in the chat section, or you can follow us on social media, send us a DM, look for the number and the link in our bio, wherever it is, and you will be sure to have this very personalized experience to get you to reverse diabetes. And thank you so much to every single person that has joined us this evening for this webinar. I hope that you learned something. I hope that you're a little bit wiser about the fact that you indeed can reverse diabetes. It is possible for you. So, once again, I'm putting this number in the chat section for you. I want you to take advantage of that. 60,000 naira, 12 weeks, and you can reverse diabetes. All right. I would leave the stream on for a couple more minutes so that you can take down the number, you can save it, and you can chat us immediately. I'll be sure to give you a response. So thank you to everyone that joined. Thank you to Dr. Maka. Thank you to registered dietitian Tito, and we would see you next time. All right, thank you so much to everyone that joined us. Once again, you can find the number to send us your WhatsApp message on in the chat section. So if you're on Twitter, if you're on YouTube, just check the chat section. You can take that number down, and we would be able to get back to you. You can use it to register for the 12 weeks program to reverse your diabetes. Send this message to your loved ones, send it to every single person that you know. Reversing diabetes is possible. We heard from a doctor and a registered dietitian that it is possible for you to reverse your diabetes. So I want you to take advantage of that. For 3 months at 60,000 naira only in one time payment, you are able to have a personalized experience. So, once again, thank you very much for joining. Social media, send us a DM, keep up with us. We're constantly sending information to help you manage chronic conditions, diabetes, PCOS, hypertension, obesity, and so much more. All right, we'll see you next time.